So my name's Emily Symington. I'm a GP. I work clinically in Lewisham and also in Croydon. So group consultations were actually not developed in this country. They were initially developed in the US and Australia. And there are several places in both those countries where group consultations are really quite well established. They first came to the UK probably about 10 years ago, and there were definitely some small pockets, both of GPs and of clinicians in other specialties, particularly mental health, who started playing around with group consultations. Those were, all to my knowledge, quite successful, but they were fairly individual person specific. So there were individuals there who were doing that for themselves, but they weren't creating a service that was then reproducible for other people. And it's really been in the last kind of 3 to 5 years that we've started to look at group consultations on a much broader spectrum in this country, and starting to think about how we can integrate this model of consulting within normal everyday practice, both in primary care and in secondary care, and see how it can complement the services that we already deliver. I first got involved in group consultations through my work in Croydon. I was leading a programme that was supporting GP learning and development around self-care, self-management and shared decision-making. And I was looking for a way of supporting GPs to move forward with these concepts in recognition that actually it's very difficult to always deliver that within the constraints of a normal 10-minute face-to-face one-to-one appointment. And that was when I came across group consultations and felt like they provided some of the answers and some potentially a slightly different dynamic that could support self-management and shared. A group consultation is a one-to-one clinical interaction with a GP or a practice nurse or another member of the clinical team, carried out in a group setting. It is not a peer support group or a group education session or something like that. Having said that, it contains lots of elements of those. And I'll run you through the process very briefly. Most group consultations take somewhere between an hour and a half and 2 hours for the patients. And what happens initially is that patients come together and they are pulled together by a facilitator. That's traditionally a non-clinician. In the GP setting, a senior member of the admin team or someone like that, practice manager, someone like that is ideally suited to that role. Someone who's experienced in managing patients but without clinical knowledge. And in that first half an hour or so, the group has an opportunity to get to know each other, to establish a few ground rules and start to think about what questions they would like to ask the clinician when they arrive. About half an hour in, the clinician arrives, has an opportunity to have a quick chat with the facilitator in terms of how is the group going, what's been going on, and then is put in the hot seat, as it were, and initially answers the questions that the group has come up with. It's a very interesting process, this, because it really changes the dynamic that you would normally get when patients come to see me normally. I'm asking them questions, and suddenly it's turned the other way around and patients are asking me questions. After you've provided the explanations to these questions, and they're often quite lengthy and quite in depth, we go on to the one-to-one consulting sort of aspect of the group and go round as a clinician to each member of the group and give them an opportunity to have a personal discussion about their aspect of that long-term condition. So if the group's in diabetes or COPD or whatever it is. Change prescriptions if that's necessary, organise for referrals to be done if that's necessary. So all the things you would normally do in a one-to-one consultation. When you get to the end of that, the clinician leaves. This is a really important aspect of a group consultation in that the clinician leaves and the group remains with the facilitator. And then with the facilitator, the group are encouraged to reflect a little bit on what they've heard and what they're going to do differently moving forward. And that's really one of the key aspects of supporting the sort of self-management and shared decision-making aspects of group consultations, because people are really encouraged at that point to be taking responsibility for themselves without the clinician there sort of wagging their finger and saying what the right thing to do is. So the obvious place to start with group consultations is with long-term conditions, and those conditions that have got a substantial kind of lifestyle element to them, where people are really having their day-to-day lives affected by whatever their condition is. So diabetes is very often the place to start, but COPD, asthma are also prime examples of good conditions. Eczema in children, We've also been thinking about, but haven't quite done yet, group consultations for new mums, and then being able to do things like childhood immunisations within a group consultation setting. So there is a lot of potential, but the place to start is undoubtedly with long-term conditions, where people really need to be understanding their condition well, so that they can then, on a day-to-day basis, be making the right decisions and carrying out the right aspects of healthcare to keep themselves well and happy. So I think there's a few things that are particularly positive about the group consultation model for children. First thing to say is that children understand groups because they sit in classrooms all day, and so they often adapt to the group setting really well. The other thing is that by the nature of a group consultation, the children and young people become much more involved in their healthcare. What we tend to find in a one-to-one consultation is that very often, other than being physically examined, the conversation is very much with parents. And that's a problem. It's not great for small kids, and particularly as children are growing up and becoming more independent. They need to be more and more involved in their healthcare. But parents tend to take over. It's sort of probably a little bit inevitable. Whereas in the group setting, you can really encourage children and young people to take responsibility, to be asking their own questions, to be getting the answers to the questions they want. We've done group consultations in asthma for teenagers, and we've actually ended up often doing those group consultations without parents present. Those children and young people probably wouldn't feel confident to come to a one-to-one consultation alone, but they're perfectly happy in a group to do that. And that really allows that conversation with that young person about, well, how are you managing your asthma? How's it going in school? What do you do? And then learning from their peers about that. And I think, particularly when you think about that transition from sort of childhood to into adulthood and taking your long-term condition with you, that is a hugely important piece of learning. And we know that transition from child to adult services has always been a big problem. I think the other place where it works really well is at the other end of the scale, with very young children, where parents can feel very isolated. Managing an unwell child, even if their condition is not life-threatening, can be a really big burden for parents. It can feel very isolating. They can feel worried about what they should go and do with their children and all those kind of things. And as soon as you're into a group setting, they've got other parents there with children of a similar age, they can then start to share those experiences, hopefully dissipate a little bit of that anxiety and get a bit of encouragement about what they can go on and do. The first thing that is the most important when doing a group consultation for children and young people is timing. Do not hold a group consultation for teenagers at 1 o'clock in the afternoon. They're all at school. So that is very important. For very small children, for babies, you want a group consultation that's late morning. That's the best time to get babies at their best. And for school-aged children and older, you want a group consultation that's in the afternoon after school. Or you schedule it in half term or the school holidays. And in some ways, that's a huge advantage. We know that actually children and young people don't always find it very easy to access GP services because our day-to-day appointments are not terribly flexible. But when you're organising a group like that, you can specifically choose your time and specifically make it appropriate and available. The other thing is having a room that's big enough and some facilities for entertaining children so that you don't end up with a bit of a riot. Actually, I don't think that's something you need to worry about too much. My experience is that actually the children tend to sit pretty well and they tend to be interested in what they're hearing, so they tend to be quite engaged. But it is going to be an hour and a half to a 2-hour period, and children are going to need to move around in that time and sort of come in and out in terms of their concentration, and particularly for younger children. Children adapt very nicely to group settings. They get on with it well, and they gain a lot, and it can really put them more in control and with better understanding of their condition. I think the main thing is about actually just getting on with it and enjoying it. The big thing for me about delivering group consultations is that they're fun. They are less structured than a normal one-to-one consultation. You've got rid of a lot of the time pressure that you have when you're sort of trying to churn through people in 10 minutes. Therefore you can relax into it and enjoy it. I would suggest to any clinicians, be prepared for some quite in-depth questions. I have actually been surprised and very impressed with the types of questions I've received from patients, from young people, from parents, in relation to their condition. People really wanting to know information about the background, about what they're going to expect, about what sits behind some of the treatments they're being offered, whether this is the right thing for them or not. And I think in some ways you're put on the spot a little bit more than you are in the 10-minute where you're sort of shoveling them out the door quite quickly. But you can really enjoy that and really get involved with that and help people as well, help to make it fun. I mean, when I've done asthma group consultations for younger children, we've set up peak flow competitions. So you get a few peak flow meters and you get them to compete with each other because you want, that's the nature of how it works, and that's fun. Don't underestimate how challenging putting in place a change is. In my experience, the challenges are all in relation to timetabling and logistics and who's physically going to be there in terms of people, what room's going to be physically available, what time is it all going to happen, all those kind of really nitty-gritty things. That is a challenge. How do you get it embedded in your service and happening sort of in a on a routine basis? Beyond that, actually, it's a question of just getting on with it, and the patients they take you on a journey and they ask the questions they want. They are in control, and that's a very enjoyable and pleasant thing to see. The kind of results that they've shown have been improvements in HbA1cs and blood pressure for diabetics. There was a very interesting paper published recently that showed that women who had group antenatal and postnatal care were more likely to take up long-acting reversible contraception in the postnatal period. So some quite interesting, tangible improvements in care offered and improvements in outcomes coming from there. In this country, as I said, there's not a lot published. The preliminary results that we got from the pilot that we ran in Croydon definitely supported the idea that HbA1c is improved for adult diabetics going through group consultations. And we are now very much working towards trying to pull together an evidence base for this country, because we are certainly getting to a stage where we can have that, and we need to start getting that message out into the literature. When we're thinking about group consultations, sometimes people get a little bit worried, and there's certainly been some comments in the press that have suggested that we're looking to replace one-to-one consulting with group consulting, and you'll never be able to see your GP again except in a group with 15 other people, which is clearly what nobody is suggesting, and I would hate anybody to think that that was the case. Group consultations are not suitable for example, diagnosing someone with a problem or seeing somebody who walks in off the street feeling unwell. That would never be the right thing. Where group consultations are hugely beneficial in our experience, both in primary and secondary care, is when you've got somebody with a condition who is then having to manage that, move forward in that condition, probably manage it at home. And so group consulting, I hope and think, has a very valuable place within the way we deliver healthcare to everybody of all ages, but it will never and never should be thought of replacing a lot of the things that we already do, and we already do extremely well.